This fall, as the nation continues to battle the COVID-19 pandemic, Black CEOs and young Black leaders from across the country teamed up for a series of conversations about vaccine hesitancy and misinformation, with a specific focus on questions from young people about the vaccine.
We know that the best mask to protect yourself is the N95 mask, and it puts a really, really tight feel on your face. Um, there's some people that can tolerate doing that, and some people cannot. So it's very clear that the cloth mask that's multiply, so two or three different layers, can add significant reduction in your ability to get infected.
That's Dr. Georges Benjamin, Executive Director of the American Public Health Association, talking with Dede Effon about the importance of the COVID-19 vaccines, vaccine efficacy, and the importance of wearing masks as students and teachers return to the classroom.
Hello, my name is Dede. I am a first year college student at the University of North Carolina at Charlotte, and my major is public health.
Well, it's good to meet you.
Yeah. Nice to meet you too.
And I'm Dr. Georges Benjamin. I'm the Executive Director of the American Public Health Association in Washington, D.C., and I'm an internist and an emergency room doc.
Awesome. So my question for you today is, I am vaccinated. So why is it important for me to wear a mask in public, at school, and when around others?
Well, this vaccine is very effective in doing two really wonderful things. Number one, preventing you from getting really sick and dying. And it does that extraordinarily well. The second thing, of course, is that it prevents you from getting infected, as well as transmitting this disease to other people. But it doesn't do that as well as it does to prevent you from getting really sick and dying. So that we know that if you wear a mask, that you add another layer of protection to yourself. With this particular strain we're seeing, this Delta strain, it turns out is much more infectious than the original two strains that we saw. And that mask helps compensate for that little bit of change in the vaccine's protection that we're now seeing.
In this case, would you continue to suggest to wear clothed mask, or what would be the best mask to protect this even more?
We know that the best mask to protect yourself is the N95 mask, and it puts a really, really tight feel on your face. There's some people that can tolerate doing that, and some people cannot. So it's very clear that the cloth mask that's multiply, so two or three different layers, can add significant reduction in your ability to get infected. And if you consolidate that or combine that with the vaccine, then you're gonna be much safer. And at the end of the day, this is all about reducing your risk. Take the vaccine because it dramatically reduces your risk, and adding the mask because it can reduce your risk further should you come exposed to someone who happens to be unvaccinated in particular and now shedding virus.
Okay, and my last question is, as a new college student, of course, there are many events that we are attending indoors and outdoors. And it is always suggested that we do wear a mask indoors, but outdoors is not necessarily clarified on how we should handle that situation. What do you think is the best procedures outdoors?
Again, it's all about risk, and I think that indoors is more risky for sure. Particularly with this new Delta virus, we're encouraging everyone to wear a mask indoors until we get substantial community spread reduced. So in those communities where there's a lot of community spread, absolutely need to wear the mask indoors. Outdoors, it's less risky. In fact, it's much, much less risky. But if you're in a really big crowd, wearing a mask is not a bad idea.
Thank you.
And listen, thank you for what you're doing. This is really neat to have you here with me today.
Thank you.
Absolutely.
I'm enjoying this.
Yeah.
So thank you guys so much.